All right, let's look at gestational hypertension. Here is our case. A 19-year-old gravida 1 is seen in the outpatient prenatal clinic for a routine visit. She's 32 weeks, confirmed by first trimester ultrasound, so her dates are sure. She has no complaints. Specifically, the 3 things she denies is headache, epigastric pain, and visual disturbances. Those are something that we always need to ask in terms of preeclampsia. Headache, epigastric pain, visual changes. She has none of those. She's gained 2 pounds since her last visit 2 weeks ago. What should be the weight gain during pregnancy? 1 pound a week? Is that appropriate? Yes, she's right where she should be. Her blood pressure, however, is 155/95, so she meets the criteria for hypertension. But hypertension is not diagnosed on one blood pressure reading. You need to repeat it, and we repeated it, and it was still elevated 10 minutes later. Trace pedal edema, the significant finding on this case is, even though she has hypertension, she is negative in the urine for protein. Negative for protein. Gestational hypertension is defined as sustained elevation of blood pressure, but no proteinuria after 20 weeks gestation. Symptoms? None. Any physical exam findings? None. Unremarkable. All we have is isolated finding of hypertension without proteinuria. Gestation 20 weeks or more, sustained hypertension, no proteinuria, diagnosis, gestational hypertension. Now, after the pregnancy is over and the patient had a diagnosis of gestational hypertension, if the blood pressure normalizes, in retrospect we say this was transient hypertension. If during the pregnancy she had elevation of blood pressure, no proteinuria, but the blood pressure remains elevated, what we'll say is she probably had new onset of chronic hypertension that just happened to begin during the pregnancy. So gestational hypertension is a mixed bag, and it really is a statement that she developed hypertension in the last part of the pregnancy without proteinuria. Now, hypertension in pregnancy is linked to later cardiovascular events, just as patients who have gestational diabetes have a higher rate of type 2 diabetes later on. That's the end of gestational hypertension.